I'm going to have Tina on here later, and she's going to really show you exactly how to use this thing, because you can't find any information on the internet. As an adjunct to toothbrushing, this is probably the best thing out there. So we give them to our patients, and they tend to love them. But what they tell us is, how the heck do you use it? If you notice here, picture your gums, if they're inflamed, you can't really measure and get down into there with floss. So what you want to do is get this Waterpik, and you're going to direct it into those little areas in the gums. And these measurements, and you see the little perio probe, those measurements are going to go from the 4s and 5s, which means inflammation, it means bacteria, it means gum disease basically. Those are going to go down to 3s and 2s, and that's where you can clean it at home, and you can clean it effectively with a Waterpik. Basic concept is, if you have gum disease or if you're trying to prevent gum disease, this is going to be better than flossing, in my opinion.
As you plug it in, it has this little reservoir. You just fill this up with very warm water, like tea warm. And then you just make sure the suction, you just push it down, make sure you get that good suction. For the beginners, you're going to want to start off, because it has a setting, power setting from 1 to 10. The beginners, you want to start off low. You don't want to turn it on until you got to be in the sink, and there's a little pause button. You have to pause, and then you can turn it on. It pulses out and pulses. You want to be in between, right here, like at a right angle, in between the teeth, and you're going to let it, you're not going to have the pause button on, you're going to let it pulse in between the teeth there for like 3 to 5 seconds, and then you can just move, and then back 3 to 5 seconds. You have to go in between and let it pulse there for 3 to 5 seconds before you shift. Like 1, 2, 3, and then move. 1, 2, 3, then move. There's an area of holding, like a tank holding of bacteria and food that collects there until you come to your dentist or your dental hygienist. Mm-hmm. So the Waterpik goes underneath there and it actually vacuums and flushes that out. People that do use Waterpiks have less bleeding. They have more comfortable visits when we go in there and we clean underneath the gums, because it is a physical workout of your gums, and the gum tissue is firmer.
Get your Waterpik and use it.